I have promised for the last hour to explain the experience I had in the emergency room on Monday, and Shane, because he was drug along with me, because I think it's probably similar to the experience that many of you listening and watching have had, and I think it's unacceptable. So obviously, I went to the ER on Monday for severe stomach pain, got there, checked in, let them know I was having an issue, and the wait began. Surrounding Shane and I in the emergency room were so many people, it was overwhelming. It was about a 20 by 40 foot room, and there were probably 75 people in there, I would say. With conditions, I had hours and hours to talk to these people, get to know them, with conditions ranging from allergy attacks to cellulitis, to broken bones, to illness. And all of them were stuck with me waiting and waiting and waiting. And I've been to a lot of ERs. I'm a bit of a klutz, broken quite a few bones, spent my fair share of time in an emergency room. And so I've seen a lot of different emergency rooms and how they operate, including Broward General Hospital down in Florida, which is a trauma center, and it's the county hospital, and it's nonprofit. So, none of these are an excuse to run poorly. But the hospital we went to obviously was short on funding because they were out of beds. So many people had been sent to that facility as opposed to the surrounding facilities. And there are literally 3 other hospitals within a 15-minute drive. But so many people had been sent there either by their insurance company or because it's a densely populated area or because, it's an emergency and they went to the nearest one, that they were overwhelmed. They were completely and totally overwhelmed in a way that no patient or staff should ever have to experience. We were sitting there, and Jim, I think you have a picture you can pull up. This was Richard. For people watching on Free Speech TV, this is literally the type of stuff that was sitting around us in a room while people were coughing with unknown illnesses. While for people listening on the radio, it's a picture of a gentleman who has an IV tube in, not the whole IV attached, but the needle and the tubing to start an IV.
So essentially, there's a needle in his vein, arm. But then the opening on the other side is open and exposed to the entire room, which of course is a waiting room with a bunch of sick people in it.
Right.
It's not like there was an IV bag on this if you were listening on radio. This was just an open entrance into his circulatory system.
Right. I asked his permission. His name is Richard, and he was there suffering. He had an allergy attack to his allergy medicine. It was a very serious situation, something that could have killed him. He had to go into the ER to get the appropriate medicine to survive this really serious allergy attack. And he was left sitting there with that open IV and then sent back to the emergency waiting room. Mind you, these are just, hard plastic industrial chairs in a tile room. So people are sitting there with injuries. People like myself sitting there in pain on hard plastic chairs for 6, 7, 8 hours waiting to get a bed because they were so full. Now, we've gone to other hospitals in the area because of other emergencies, and the waiting rooms are fine. Waiting rooms are empty. But from my work in insurance and my knowledge of insurance contracts, I can tell you that our insurance probably has the best deal with that hospital, so they send people there. But, we use United Healthcare's network. That's not our carrier, but we use their network. So I can say with all certainty that United Healthcare has a contract with every other hospital in the area. I guarantee it. I would bet my left arm on it. But the best rate they get is most likely at this facility. So they send everybody there. It leads to patients like myself sitting in pain for hours, wondering if my appendix is going to explode. Thankfully, it didn't turn out to be the case, but wondering if my appendix is going to explode in this really disgusting, overcrowded, germ-filled waiting room. What a scary concept. We literally watched 2 different groups of people, there for one individual who is waiting to be seen, leave to drive to another hospital to get treatment.
Not just another hospital in another state.
Yes.
Now, granted, this is a small area, but that's a hike from where we were.
And I want to say again that this is not the fault of the doctors and nurses who were working there, and they handled such an overwhelming scenario with a grace and a patience, with patience as in understanding and calmness that I could not have ever been capable of. I could never do what they do, and especially considering that they often work 12-hour shifts. These people are saints for being able to provide compassionate care in such a situation. They didn't want to leave people in the waiting rooms. It didn't make their lives easier to have to continually call people back and forth and shuffle patients around and, essentially administer basic level care in an ER triage. This is all simply because that insurance company wants that lowest rate. They know that if they make it the most inconvenience on us, that we're not going to use our insurance. We're not going to use our health care. We're not going to use the things that we have a right and access to use. So then you add, the drug company is going to get their cut. The supplier is going to get their cut, et cetera. And it goes on and on and on. There is so much profit loading up the system that we don't really pay that much for actual care. You can't tell me that the bill my insurance company is going to pay that hospital. I would bet, I haven't seen their contract, but it could range from $50 to $500, but I bet you it's not going to be more than that. Despite the fact that I had to get a CT scan, I was seen by 3 different nurses,
right,
and a doctor twice.
And it gets confusing because they will send you what's called an EOB, explanation of benefits,
right.
And you're going to see this astronomical number,
right?
Thousands and thousands. But when it comes right down to it, the contract, that would be as if you were paying it out of pocket. Mm-hmm. What actually gets negotiated is completely off to the side between the nonprofit hospital and a for-profit insurance company.
Right. And I'm not blaming Doctors Community Hospital for the situation that they're obviously faced with. They have amazing people working there. They are obviously working diligently to provide care. But they can only work within the limits that they've been given. They can only work with the system as it's set up for them. That's why you and me, voter, John Q. taxpayer, need to help them get a better system. Doctors, yeah, sure, lots of them go into it for money. But they don't sit through 12 years of medical school and deal with some of the grossest and most difficult parts of life because they are hoping to get rich. Most of these people have a genuine concern and they really want to get people better. And they can't do that in our current system. That ER doctor didn't want to send me away without knowing what was wrong with me. That you could just look at him and tell he was pained by that. That's where single payer comes in. And doctors themselves are making that case. If you go over to commondreams.org, it's at the top of their site right now. 2,000 doctors are saying that it's time for single payer. If anybody's going to know, don't you think they would know best? I do. And I don't want anybody to go through the experience that I had on Monday.
To watch more clips from our programs, hit the Watch More Videos button over here. And please be sure to hit the handy dandy subscribe button so you'll always be up to date. Tag, you're it.